Hello and welcome to this episode of Let's Talk About by Kangaroo Minds. I am Vedika and today we have with us Dr. Harsha Agarwal. Dr. Harsha is the head of the Psycho Oncology department at the Rajiv Gandhi Cancer Institute and Research Center. She collaborates with multidisciplinary teams to work with both patients and caregivers towards their mindset in terms of acceptance of disease and going ahead with the prescribed treatment. She has been actively leading patient as well as caregiver counseling, both in pre and post operational cases, chemotherapy, radiation, pain and palliative care, as well as bereavement sessions for families. She and her team interact with both patients and caregivers to help them gain insight, define goals, and plan action in order to achieve desired outcomes. Dr. Harsha also has an active interest in research and has had several pieces of publications in both international as well as national journals, and she is also on the peer review board for the DRDO. Our conversation with Dr. Harsha today is going to center around coping with the diagnosis of cancer, especially from the perspective of patients and survivors. However, before we begin our conversation, I would like to put out a trigger warning for our audiences. If at any point during this conversation, should you find yourself feeling triggered or distressed, we urge you to take a step back and look after yourself. Should you need any additional support resources, you can also find them on our website. And now, without taking up much time, let's hear more from Dr. Harsha. Dr. Harsha, welcome to the episode. It's really lovely to have you with us today.
Thank you so much, Vedika, for the opportunity to interact and enlighten the people more about this stigmatized field.
No, thank you so much because I know that, the work that you're doing is something which not too many people are even aware about. So before we get into, more discussions around cancer and cancer care, I would ask you if you could, just tell for our audiences that, what is psycho-oncology and what is the role of a psycho-oncologist, especially in terms of cancer care?
Sure, Vedika. So basically, when we talk about psycho-oncology, it is about the psychological perspectives of a patient who's undergoing a cancer treatment, right? So oncology is basically cancer, and psycho is psychological issues of a cancer patient. In together, they when we club them, it becomes psycho-oncology.
Right. So can you throw a little
Uh,
bit of more light in terms of, the role that a psycho-oncologist plays?
Right. So when we talk about the role of psycho-oncologist, it is all about taking care of the psychological issues of not only patients but also of the caregivers,
Mhm.
aligning them both, basically patients and caregivers with the treatment, with the diagnosis, the way they go forward in the treatment. At times, patients do try to withhold with their treatment. They don't feel comfortable in going ahead with their treatment, or there are a number of issues which comes around as a part and parcel, right? With the treatment and the disease, because there are a lot of myths attached to this disease called cancer, right? The basic myth attached is disease equals to this disease is equals to death, right?
Right.
So, in these terms, breaking the myths and making them align with the treatment, right? Not only patients, but with the caregivers as well, and bridging up the gap between them and their clinician is the major role of a psycho-oncologist.
Right. So, one of the things that, even when I was introducing you, and I know we've spoken before, and as part of your role, you focus
Hmm.
a lot on also helping patients at the time of diagnosis. So, in your
Yes.
experience, what is that psychological impact, especially on a patient when they receive a diagnosis of cancer?
So it is, Vedic, I would say it is not only about cancer, but
Mhm.
also whenever we are diagnosed with any chronic disease, right? The impact is more or less same, but because there is a myth attached to this disease, that disease is equals to cancer, disease which is cancer is equals to death, right? So there is more stigma and there is a more fear attached to it, which brings in, with a friction of second, you can actually get into depression, or you will have panic. Oh my God, what have I gone through? What have I done? Uh, is it a result of my karma, or I have not done anything due to which I have to suffer this. None in the generations of my family ever had it. Why do I have it? So there are a lot of things. The denial happens with the breaking of the news, depression happens, anxiety attacks happen. So at that time, when it is given, the news has been given through the right channel in the right manner, it plays a vital role.
Right. I'm going to ask you, you touched upon a very important point there, which is, the news being given in the right manner.
Hmm.
So, how do you think we should, go about informing patients? Because, sometimes there is this belief that, when it comes to elderly patients in particular,
Hmm.
that maybe it's best not to tell them what's wrong with them.
Hmm.
So, what are your thoughts on that aspect?
See, I hold a little bit of different thought process, right? It is not always that we should hold the news back, right? But if the patient is willing to know, and if the patient really wants to go for it, right? If they really want to survive, breaking of the news is really important thing, because with cancer treatment, it is not only medicines which work, it is a equal role of a patient in the treatment, right?
Right.
So if in a treatment, when a patient has to play almost equal role just like a clinician, then if the patient is aware about whatever he or she has to go through, it becomes very clear to them in what manner they have to perform. Otherwise, whenever we are going for the treatment, so the basic thing which happens, Vedika, is we take our elderly or we take our youngsters to for the treatment, and we don't let them know that they are going through the treatment for cancer.
Hmm.
We tell them that there is some infection in your body, and with some doses which will be given through IV, you'll get over.
Hmm.
But with that infection stuff, we forget that there is one thought process in our brain, feed it since our childhood. Whenever we get any medication, we will feel better.
Right.
But because of the chemotherapy drugs, let's say,
Hmm.
there are number of side effects which will happen for sure,
Right.
right? And to curb them, we have to put in effort. It is not only medicine which can result in everything.
Hmm. Hmm.
There is an equal effect of awareness, of putting your own effort into it, maintaining your good hygiene, maintaining your own, let's say, nutritional levels, and also how active you are
Right.
plays a vital role. So, bringing the awareness to them, maybe, let's suppose the scenario for the elderly would be, let's say, metastatic condition. We may not tell them metastatic, but we need to tell them that they are suffering with the condition for which they have to undergo a treatment, which will have number of side effects too.
Right.
Right? If you tell us at the right time, you can also curb them and help your treatment to get better.
Right. Right.
Maybe in this manner we can start with, and slowly and gradually, post they have gone through, let's say, one cycle or two cycles of chemotherapy, when there is now no fear of any medicines or hospitals,
Hmm. Hmm.
right? We can actually let them know what they are going through.
Right. Because I think that also comes down to the whole aspect around, consent and keeping them motivated throughout their treatment, right? Because
Right.
as they say that the individual themselves is, just as important as much as, the caregivers want to get them treated is. I think it's
Hmm.
important that, the individual themselves has that buy-in because, as you said, after all, it's their body that's going to go through the
Hmm.
physical impact of the chemo or the surgery or the radiation or whatever the option might be for
Hmm.
treatment. So, how do you think we can work around, keeping a patient sort of motivated after they especially know that, they have cancer?
Okay. So, for this, I would like to start with, I have invented one new thing for cancer, right? People relate cancer to death.
Yeah.
I have created one thing. uh, I have used cancer as a, let's say, a mnemonic.
Hmm.
Cancer using is equals to cancer can be cured with effective and efficient treatment given on time,
Hmm.
right?
Lovely.
So that means if you take treatment, if you have received treatment, effective and efficient treatment, that is right treatment, post the right diagnosis, if you receive right treatment on time, you can for sure control it.
Right.
Cure becomes next part, right? It is not always that we have to focus on cure. So whenever you talk to a patient, whenever I talk to a patient, let's say, the first question is that ये ठीक तो हो जाएगा ना,
Huh.
right? My answer to them is, क्या हमें ठीक ही होना है, जो अभी हम हैं उससे बेहतर नहीं होना?
Hmm.
ठीक हम एक दिन में, दो दिन में हो जाएंगे क्या? किसी भी चीज से हम ठीक हो सकते हैं? नहीं.
Right.
बट बेहतर होना should be a goal. So our goal should be to get better,
Hmm.
right? From whatever condition we are in currently, right? So when you break their goal, ultimate goal into different goals, small goals, right? And let them make it for themselves, then they are motivated enough to take every step. Else, everybody wants to jump from ground floor to second floor directly, but no one can.
Right.
So, in that manner, we can for sure motivate them. And I have been motivating them in this manner.
Right. I think that's a very interesting mnemonic that you've come up with because, and also the analogy that, why just, look at being okay, but why not looking at being better and, better is subjective for each individual, right? It's better than what they came in as.
Hmm.
But, in all your experiences, with working with cancer patients and survivors, what have you seen, and what are some of their common thoughts and worries that they have, especially, maybe post-diagnosis, but, in terms of treatment as well?
Okay, so the first worry which they have is, one, क्या ये ठीक होगा?
Hmm.
Second, मुझे हो गया तो क्या मुझसे मेरी फैमिली को खतरा है? Third is they talk about whether am I infecting others,
Hmm.
right? Am I safe being around family members, let's say my kids, right? Then what about the finances? How much will it cost me to take treatment,
Hmm. Hmm.
right? And also they worry about that if they are going to take treatment, is it going to be successful?
Right.
Because there are so many myths attached to the treatment. For example, there is a very common myth about getting a biopsy or even a FNAC done. If we touch the tumor, it will get spread out. It will be spreaded in the body, right? So there are few things which happen. So just the lack of awareness, it is there. So they have these made thought processes. Maybe let's say due to society we have or we are living in, right? So these are few things which they first talk about.
Right. And I think a lot of it also, probably to add to what you said, will also come from the internet, right? Especially for a younger generation who has consumed so much media, either,
Hmm.
the internet or even from TV, that there are so many misconceptions around, what cancer and what cancer care actually looks like.
Hmm. A lot. I would say, see, in psychological terms, we call this as a cyberchondriasis,
Hmm.
right? So, which means that health anxiety, too much of health anxiety generated due to over searching on, let's say, internet, right?
Right.
So, yes, it is very common, very, very, very common. What we do, let's say a patient is going to undergo chemotherapy or a treatment plan which is been selected by the clinician is that the patient must go chemotherapy, then surgery, and then chemotherapy. It is just an example which I'm taking. So
Right.
what the patient will search is chemotherapy, And in the list of chemotherapy, there will be, let's say, 40 side effects and only 4 effects. Patients do not focus on the effects. They more focus on 40 side effects. And let's say they start teaching them, clicking them that, okay, this has happened, now this will happen, now this will happen, now this will happen. If 30 has happened to them, but 10 has not, so they don't think that they are lucky enough not to have another 10, but
Mm.
they'll assume, they'll trigger it in their brain, stimulate their brain to let those 10 also happen to them.
Right.
So that
This.
happen, and that do not only happen, Vedika, in the younger chaps. It is happening in the middle-aged people. It is happening in the old-age people also. It is happening way too much in every generation.
And I think, as you said, that this is something which is so widely spoken about that, even if, you've not been through it, you will know somebody who has had cancer. So, you just
Hmm.
sort of think, especially let's say for the elderly who may not
Hmm.
be accessing internet, they'll be like, but isko
Hmm.
hua, so, even I'm going to have
Huh.
similar side
True,
effects.
true, true.
Pick up on
So
that.
it's about who will talk about you, about your condition, with the confidence even a clinician won't do.
Hmm.
Honestly, trust me for that.
Right,
And with the confidence, they'll talk about your condition, whether they know about it or not, to break your confidence.
right, right.
So if you are listening to anything, trust me for this, and it is for all the viewers. If you guys are listening to anything regarding your treatment or regarding your own things, first get it clear with your clinician whether it is valid on you or not. Because many times it is not even valid on you.
Right.
They're just talking very vaguely, right? Just like one very common example which I use for people who ask me this is, okay, let's talk about two identical twins. Do they have similar likes and dislikes?
No.
If a monozygotic twins who are identical, they do not have same likes and dislikes, then how can two different people, even having same diagnosis, can act in a similar manner to something which is being given to them?
Mm-hmm.
So we should not compare ourselves.
Right. I think you touched upon how, the mind sort of plays up, and that was something I was going to come to. But, in terms of the whole mind-body connection, we talk about it a
Hmm.
lot in psychology and mental health, especially. How do you see that play out in cancer treatment?
A lot. Trust me, 80%. More than 80%, I would say. So it's
Right.
basically psychoneuroimmunology, right? So in easy term, if I use psychosomatic symptoms, right?
Mm-hmm.
So when we talk about psychosomatic symptoms, it means that you are triggering to your brain, or you are stimulating your brain to produce certain effects in your body which organically won't be visible. So for example, a patient is constantly complaining about pains, aches, nausea, right? Not being able to eat anything, and constantly, let's say, is puking, but there is no, when we let them test it, when we go for ultrasound scans, x-rays, or even even endoscopy,
Mm-hmm.
right? We don't find anything.
Right.
Why? Because there is no organic cause. It is all being generated through our brain in our body. We do feel it, but they do not actually exist. In
Mm-hmm.
the similar manner, just like I said in the earlier example with the chemotherapy and the side effects, it happens. So whatever we tell to our brain, the brain triggers it in the body, because these are basically neurochemicals released through the nervous system, right? Travel from the cranial to spinal things, right? And the body responds accordingly,
Right.
right? So it could be pain. You can actually feel the severest of pain, which will not even be relieved by really good amount of painkillers.
Mm-hmm.
But with a simple relaxation technique, you can sort it out.
Right.
Basically, such things usually happen with people who feel that they are not being attended well,
Hmm.
right? There is something which they want to express, but they can't express. They feel things are being hidden from them, right? People are not very clear with them. They are not letting them know what exactly the things are. So they start creating it in their own self.
Right.
Once they create it in the brain, you can see the results in the complaints, in form of complaints by them.
And I think, when they go through the psychosomaticization of
Hmm.
symptoms, which, might be real and but they cannot be backed up by any diagnosis. As
Hmm.
you said, you'll do an ultrasound, you do a CT, you'll do a whole range of blood tests, but you won't be able to
Hmm.
diagnose something. I think oftentimes they don't realize that that's going to put them in even more agony, going through more tests,
Hmm.
going through, just more pain, more hospitalizations, all of that
True.
as well.
The point is, there are few clinicians who understand that it is a psychosomatic thing, right? But at after certain point of time, when you go through n number of tests, n number of scans, right? But still you don't find any, right?
Mm,
They have to be referred to a psychologist or a psychiatrist.
right.
But the agony here is the patient do not want to visit a psychologist or a psychiatrist with the stigma attached to the field. That am
Right.
I mad? I'm just on a treatment of something. Why do you feel I don't have that pain?
Mm,
We understand that you are suffering. It is pain, but it is not a physical pain, it's a psychological pain.
right.
Unfortunately, patients themselves do not understand that it is not physical but a psychological pain.
And
That is the bad thing about it.
And I think that's also part of, as we said, the stigma. And it's not just the patients, it's also caregivers, it's also families, and also just the lack of awareness, even amongst clinicians, that there are psycho-oncologists, who specialize in cancer care and, mental health around cancer care. But that stigma, you just feel, I don't need this. I don't need this extra service of having a psycho-oncologist also. We're seeing so many doctors. I
Hmm.
don't need one more doctor.
True, true. So it is, honestly, I am blessed to be working with Rajiv Gandhi. Here, people understand the need,
Hmm.
right? But yes, I have seen it that there is a lack of awareness in clinicians. There is more than lack of awareness, there is lack of acceptance in patients and caregivers, right? Because of lack of acceptance, right? Even if they are aware, even if the clinicians are referring them, they don't want to visit.
Hmm.
They just, it is not also about Vedika that we are going through a treatment or clinician is asking us to visit. It is all about whether I accept it,
Hmm.
that I have it. No, it is they are ready to pay n number of amount for anything, for any scans, but they are not even ready to take a free counseling session. Trust me for that. Even a counselor who visits them,
Hmm.
they feel, why are you here? We haven't called you for,
Hmm.
right? But once we start talking to them, right, they understand the need. They
Hmm.
understand that as much as the physical health is important, their own mental health plays a equal role in their treatment.
Absolutely. And just stemming from that, can you throw a little bit of more light on, the mental health implications of cancer, ranging at the various stages? So if you want to look at, diagnosis, treatment, survival,
Hmm.
remission, and then, getting into sort of palliative care.
So, I would say there are a lot of mental health issues, right? So, as I've told you already, when we are diagnosed, right? Even I would say pre-diagnosis, there are a lot of mental health issues. For example, fear related to the spread of tumor,
Hmm.
right? Even if they touch it through biopsy or through XC, so biopsies are also of many kinds, right? FNAC is also kind of a biopsy test, right? Then we have proper biopsy. Then we have excisional biopsy where we are taking out the tumor and then we are sending it for histopathology. But they don't understand that it is a dead tissue, right? So nobody touches it. They
Mm.
just take a sample, even if we are taking the FNAC, we are just taking the sample of fluids, right?
Mm.
So the proper knowledge, lack of knowledge creates too much of panic or anxiety, and obviously a lot of things rolling in the society as a ball. We just keep giving it and passing it as a parcel to everybody, despite we know them or not,
Right.
right? We don't talk good, but we do talk bad,
Mm.
right? So the bad is rolled out more
Mm.
freely, right? So one is that. Second is that obviously anxiety related to if cancer, then what? Nothing is left. My life is over, right? I after diagnosing with cancer, a patient himself or herself would like to be isolated, right?
Right.
They don't want to be attended or they don't want any other to be surrounded by them. Even if people are putting in effort to make them feel good, they feel that the people are making fun of them. Why? Because now their lifespan is shortened,
Mm.
right? Then this was about diagnosis before starting a treatment, even if it is a surgery, chemo, or radiation, any kind of treatment, right? They have a fear of whether I should go for it or not first. If I'm going for it, whether it is going to be successful or not. Okay, if it has got successful, then will I get it back or not? The fear of recurrence is way too high,
Right.
right? Then another point in treatment is whether my treatment is curative or palliative.
Mm.
Now, any disease which cannot be cured come into palliative diseases, right? Even diabetes is among them. But people with diabetes are happily enjoying their life. On the other hand, people do not want a person who's having cancer to live happily with their life. It is not about clinicians, it is not about patients or caregivers. It is about society,
Mm.
right? So there are n number of palliative diseases, but we have stigmatized one,
Right.
right? So whether my treatment is curative or palliative plays an important role, right? They feel if it is, we are just trying to control the disease, it is not going to get cured. Then what is the point of putting in money? What is the point of putting in effort into it?
Mm.
I had to die, I will die. They don't understand if they're not taking treatment, then
Mm.
they're going to suffer like anything. They
Right.
don't understand. They just miss this part that go for the treatment, whatever treatment is, quantity or no quantity, but quality of life is your right to have.
Mm.
You should at least have a good quality of life, whatever quantity you are having. Nobody can assure or guarantee that you're going to have only 6 months or a year,
Mm.
right? Even I am equally uncertain about my life as a patient, any patient is, right? Nobody can guarantee you how much life you are with,
Mhm.
but at least live your life every day. Why are we waiting to live our life for next 1 year, in next 1 year? Why can't we live it every day, right? And then when we are turning into palliative, let's say palliative that to terminal, right? The major causes are now I have created a lot of debt to my family. I have become a burden on them,
Right.
right? Now, what are they going to do? I should not carry on with my treatment again. We have already lost a lot of things. Now, इससे अच्छा तो मैं मर ही जाऊं तो अच्छा है और ज्यादा suffering नहीं चाहिए. But they don't understand again. Even a pain management stuff, even if they just have to go for home care or pain management thing
Mm.
or a hospice thing, which we say,
Right.
it is the need of the hour.
Mm.
It is not what you should not go for, but you should always go for. So it is really important to not to miss this pain, palliation, and hospice thing. These are all related to the peace and good quality which a person deserves and it is their right to have.
Mm-hmm.
So
And
these are the things, Vedika.
And I think, as you also said that, sometimes what patients don't realize is that not carrying on with treatment and sometimes
Hmm.
not cooperating. Just say they're not going to eat or
Hmm.
don't want
Hmm.
to take their medication. It's going to make it very painful. It's not that this is going to pause your pain. It's just going to make it worse.
True, very true. So the nutritional part, I would say, see, with the chemotherapy, it becomes that even if you feel hungry or you don't feel hungry, you should make nutritional needs and you should meet your nutritional needs every day, right? Which should be guided by a proper clinical dietitian, right?
Hmm.
You should not know, and how would you know that what is your need or not, right?
Right.
It should be guided by a clinical nutritionist, right? Who will look at your treatment plans, who will look at your own BMI, your own composition of the body, current composition. Based on that, she will make a plan for you because it will keep on varying. At
Hmm.
times, you will have all arranged things. Maybe there is no derailment in your, let's say, CBC, LFT, or KFT. uh, okay, so I should not be using more clinical terms. Maybe there is no derangement in your blood markers, which is very simple, hemoglobin or our TLCs, right? Which is for the white blood cells and red blood cells, right? There, हमारा liver functioning is doing good, हमारा kidney functioning is doing good. There is no derailment, or even the lipid test, which is for the heart. Everything is within the range. The nutrition which you have to take at that time, even when you are on treatment with, let's say, chemotherapy, is very different. Then for a patient who has thyroid, let's say, or who has fatty liver, or who has undergone some cardiac surgery some
Hmm.
time back, let's say 10 or 12 years back, for them, the nutrition demands will be different,
Right.
right? So that should be met by a proper clinical dietitian and a
Hmm.
nutritionist, right? So do not go by whatever you want to eat, right? Meet a dietitian, talk to them, right? Let them be known what are your likes and dislikes, right? What you want to eat. Ask her do's and don'ts proper
Hmm.
and take a proper diet counseling with them and regularly meet them. This
Hmm.
is one very normal question which I am meeting every day, with n number of patients I'm meeting, because I have been talking to them for, let's say, more than any clinician or more than anybody, right? And they feel, acha, we can talk about diet also with them, because I'm guiding them that you should have, despite telling them what you want to have, what you should or should not. Be guided by dietitian. They'll ask me queries, so I ask them to ask your dietitian first,
Hmm. Hmm.
because I am not a dietitian, so I can't guide them properly. But yes, meeting nutritional demands of the body is very important with treatment for cancer.
Right.
Very, very important.
Dr. Harsha, just moving away from this, but how do we recognize and sort of help an individual with cancer to, sort of cope with that fear of dying? Because as you said, cancer is sort of equated to death. It's one of those diseases which we immediately just think of, almost like a death sentence.
Hmm.
We don't really see much hope when, we hear that someone's been diagnosed with cancer.
With cancer.
So how can we sort of, cope with that or help the individual rather cope with that fear of dying?
So for in such situations, what I usually do is let them align with the current reality first, right? We are foreseeing a future today, right? Which we are not even sure of is going to happen or not, right?
Hmm.
I agree. Cancer is equated with death, right? Or I would say was. was is a better word. Why?
Hmm.
Because if I'll see in early 90s, 91 or 90, up to 95 maybe, people were fearful about cancer and its diagnosis and its treatment. But now, with this so much advances in the treatment, right? Every year, whatever is in the start, we have a better version by the end of the year, right? So I align them with the current realities, right? Align them with the line of treatment, whether there is a treatment for them or not, right? If you let the person understand, be whatever you have, your disease or your condition has a treatment. So you should focus more on the solution, which is treatment, than on the problem. Problem is there. Now you can't run away from the problem. Even if you are running from the problem, problem is running with you. So what the worst would be, you have to, after getting tired, you will stop and you will accept it. Then why not now?
Hmm.
At
Hmm.
least see the possibilities what you can do.
Right.
When you get yourself aligned with the possibilities, then you start getting that hope back.
Right.
Okay, so I have this thing which I can do, which is in my hand. Because disease now is not in my hand. I cannot choose to delete disease from me now,
Hmm.
right? So I don't have any shift delete button in my life which I'll press and just get over with the disease. But yes, for sure, I can try to find out the keys which will help me deal with the problem I have in my hand. So align them with the reality, give them reality checks, then let them accept that even if the disease is there, the treatment you will get through, right? Let them align from the very starting with the quality instead of quantity. So
Hmm.
I align my patients even who are on curative treatment, definitive treatment, which we say. I align them with the better quality than the quantity. I never ask any of the patient to focus more on quantity.
Hmm. Hmm.
Why to focus more on quantity? First, let's start living the quality, right? Quantity comes hand in hand,
Right.
right?
When you talk about alignment to treatment and coming back to, the whole media, WhatsApp, internet, so many times you will have, or even just suggestions, random
Mm-hmm.
suggestions that somebody heard, read. People will come up with suggestions like, have you tried Ayurveda? Have you tried homeopathy? Have you tried, ye wala diet try kar lijiye. So you will have a lot of suggestions of this sort coming at you
Mm-hmm.
as a patient as well and as a family. So how do you sort of navigate and sort of continue having faith on the clinician rather than also trying for, or, looking at alternatives sometimes?
See, I would like to choose not to answer this though, but yes, see, I am not disregarding any other pathies, right? Whether it is naturopathy or Ayurvedic or homeopathy, right? Uh, Everybody who is going for anything. See, I suggest my patient, you choose a pathy for yourself,
Hmm.
right? Whether it is naturopathy, Ayurvedic, homeopathy, or allopathy, the decision has to be yours, but do not mix two things,
Right. That's
right?
the point I was coming to. How do you sort of adhering to treatment also means that, yes, the patient's consent matters, but how do
Hmm.
stick to that line of treatment? Because it's very easy to get wavered in
Yes,
because
it is
whenever
very
you
easy.
see hope, especially in cancer care, you're very tempted to jump at that hope. The faith
Very
plays
much
such a big role, right? Oh, this worked for somebody, let's try it. But as you said,
true.
two bodies are not going to respond to the same disease in the same way.
Absolutely, Vedika. So what happens is I ask them not to mix two things. If
Hmm.
you want to go for Ayurvedic, go for it only. If you
Right.
want to go for homeopathy, go for homeopathy only. If you
Hmm.
want to go for naturopathy, go for that. But if you want to go for allopathy, go only for one thing, one line of treatment at one point of time. Why? Because if you mix two, you yourself won't be sure about which one is benefiting you or which is deteriorating you.
Right.
At
Right.
least if you will go through one line of treatment, you can say it is good or it is bad
Hmm.
for yourself. Obviously, you can't generalize that. Maybe you're not responding to one thing, but you may respond to other, or other may respond to same,
Right.
right? So it varies from individual to individual. You can only say you this suited you or this does not suit you, right? But you
Right.
can't generalize that too,
Hmm.
right? So
Right.
it is not anybody else's decision, and it should not be. It should always be patient's decision what they want to go for,
Right. Right.
right? So never mix two things. This is what I tell them. Adhere to one line of treatment at least till the time you get to a conclusion. It is giving you any benefit or it is not at all benefiting you.
Hmm.
At least till that time, stick to one line of treatment.
Right.
That is more important.
Right. And Dr. Harsha, in terms of cancer care and cancer recovery, we talk a lot about recognizing distress. We use this term distress a lot in terms of cancer and just sort of recovery treatment, as I said. So, how can we recognize the signs of distress and support someone who's dealing with it?
Okay. So, distress in terms of patient is different, Vedika, and distress in terms of caregivers are different. Okay. But common signs would be agitation,
Hmm.
getting irritated on very small things, right? Not eating well, not having enough sleep, right? Even if they are sleeping, they do not feel rejuvenated.
Hmm.
These are few common signs, right?
Right.
Leading to a lot of things, right?
Hmm. Hmm.
Restlessness, maybe comfort issues. They'll start their performance starts deteriorating. They will be more on the go kind of stuff. They'll be more acting on impulses. They'll be more aggressive than any time else. Even they themselves would be feeling they have never behaved in this manner. Then how can they behave in this manner? How
Hmm.
can they shout? How are they behaving? Why are they being so agitated? Or this actually leads to, if not settled at time, this leads to dejection and burnout,
Hmm.
right? So these are common signs and symptoms if we are seeing them. So what I do is in my patient, for my patients, I actually tell them, you may have mood swings. You may feel that you are not interested in talking to anybody. You may feel to be isolated. You may feel that you don't want to be talked about or you don't want to talk to anybody, right? You may feel if people are laughing or if people are smiling or making or trying to make you happy, you may feel that they're making fun of you.
Right.
At times, you may feel aggressive. You may shout at the people you love, and after that, you will feel regretful or guilty too,
Hmm. Hmm.
right? So, at any point of time, you can anytime say sorry to them. You can anytime hug them and express that you are not feeling good. And it is okay not to be good.
Right.
It's not that you have to be good every time. Even we as a psychologist, we can't be good every time. We
Hmm.
do feel bad. It's okay to cry. Don't ever feel that if you're crying, it's a sign of being weak.
Hmm.
I say when you cry, it is a sign of being that you are having good strength. You are powerful. You accept that you are suffering. You accept that you are not feeling good. This acceptance means a lot.
Hmm. Hmm.
So it's okay to cry. It's okay to feel bad. It's okay to feel agitated. It's
Right.
natural. It will come. You are also human. If we can feel bad, so can you. Why not? In family and caregivers, another point of distress is, for example, let's talk about finances, right? They have to manage finances, right? And they
Hmm.
don't want their patient to know about it,
Hmm. Hmm.
right? They have to manage a lot of things at the family end, at their own end, at the patient's end, at the clinician's end also.
Hmm.
But they can't reveal everything to the patient.
Right.
So they feel more burdened, they feel more stressed, and they actually have a lot of burnout
Hmm.
because at times patients are also agitated, patients are not ready to listen, they are helpless on their end, caregivers are helpless on their end, right? What happens is cumulatively both get hopeless,
Right.
right? So the main point here comes is accept that you are suffering.
Hmm.
Go and meet a counselor or a psychologist. You deserve to feel good because you are getting treatment or you are letting a person you love take a treatment that doesn't make you qualified to suffer, right? So you're not going to get a PhD in suffering. Instead, accept your fault, accept that yes, it is not a fault, it is that it comes with a process. You
Hmm.
are going through a process and it comes hand in hand. Why not to get over with it?
Right. And I think, I'm so glad that, we were able to have this conversation because I think it also comes down to a lot of times, we spoke about that a lot of people are not aware of, psycho-oncology and, that you can get support. But also from a clinician perspective, patients are very
Mm,
rarely asked that, how are you feeling emotionally? So much of the conversation around cancer is around, Acha, what symptoms are you experiencing? Are you feeling nauseous? Are you having pain? You're just talking about
mm,
physical symptoms without really addressing, like how we spoke about the psychosomatic underpinnings which could exist to certain
mm,
symptoms. Or just the fact that this can take such a huge emotional toll on an individual, not just because of the misconceptions that exist, but also just that it's heavy. You're seeing as cancer, they say it's not just on an individual, it's an entire family that sort of receives that diagnosis. So
mm.
you're seeing your loved ones suffer. And I
True.
think it also plays such a big role. But when we talk about, treatment and everything, you and I recognize that, caring for the mind is just as important as caring for the body. So, what are some ways in which the individual themselves who is diagnosed with cancer can sort of practice self-care or look after their mental health?
So for that, first they need to understand that they have a big role to play,
Hmm.
right? It is not only clinicians who have a role, right? But you yourself have to play a big and important role in your own treatment, right? And if they involve their family into same, right? Getting isolated or getting away from the family won't be healing anyone, right?
Hmm.
It is disturbing for both, right? Fortunately, I am working with the people who believe in holistic healing,
Hmm.
right? So a surgeon is also asking the patient that
Right.
you have to undergo this. How do you feel about it?
Hmm.
A medical oncologist is also asking their patient that you will be undergoing chemotherapy, so they are making timely referrals to me, and I am visiting every new patient, a
Hmm.
patient who's having distress or burnout, or patient who's not adhering to the treatment,
Hmm.
or patient who's trying to withdraw from the treatment,
Right.
right? A radiation oncologist is also referring patients, right? I am blessed to be working with fabulous clinicians, but at the same time, when we talk about to self-assess ourselves, right? First, accept the role you have to play.
Hmm.
So it is like for 50% is clinician, 50% is you, right? Now, in this 50%, first, take time for your own self. Do not consider this time period of your treatment as you are now, you will be left behind from the league. Consider this time frame to reinvent yourself, then involve into let's say mindfulness activities. For example, a person can start with the focused breathing, leads to regular practice of pranayam and regular healing practices, for example body scanning,
Hmm.
right? Relaxation techniques, there are a lot of relaxation techniques which they can follow at their home also, right?
Hmm.
Instead of doing it alone, do it with your loved ones so that you guys feel connected to each other,
Right.
right? This connection should not be lost,
Hmm.
right? So basically, what happens is there is a curtain now which has been drawn between the patients and the caregivers,
Right.
and both are aware about each of things, right? Each of the sides actually, but none of them wants to withdraw that curtain,
Hmm.
right? That is the thing. So there should not be any curtain. Be very frank, be open to each other so that the person, patient, and the caregiver as well, they feel that yes, person understands you. If you're not feeling good, be open about that. If you want to do something, be open about that. Never feel burden of being burdening the spouse or children or let's say family members,
Hmm.
right? You are not burdening anybody. If anybody is doing something for you, it is because they love you, not because it is their let's say duty or a responsibility. It is all out of love they are doing. Else anybody can withdraw from their duty and responsibilities. It is not a mandate for them to do anything for you, right? Then obviously timely visits to your clinicians and psychologists. Other than that, also go and spend some daily time for your hobbies, let's say, right?
Hmm.
There are some activities we always want to do since our own childhood, but we never got the time to do that. Try to scrape those things out
Hmm. Hmm.
and involve yourself into things.
Hmm.
The motto is majorly to keep yourself happy. If you keep yourself happy, you are healthy from your brain, right?
Right.
Which will release good, let's say, hormones in your body and nice neurotransmitters if are released. Obviously, your body is going to perform well,
Right.
right? So for that, the key is positive attitude, happy mind leads to healthy body, and yes, maintain one good bond amongst yourself. Never let that bond go away. These are the things.
Right. No, thank you so much, Dr. Harsha, not just for, all your time, but also for everything that you do to, make a difference every day. I really appreciate, you being here, you sharing all your insights, and I'm sure this can be really helpful to people to sort of reimagine what cancer care has to look like as well. And lastly, for anyone who's watching this or listening to this right now, please know that, if you're having a hard time with your mental health, you don't have to go through this alone. There is help out there. It gets better. So please reach out and, hold on to that hope. So till next time, please stay well and stay healthy. Thank you.